Ask Me Anything, edition number 500. I don't know. Been doing these since 2020, and it's something that I always enjoy doing because your questions are always going to help me, stay at the tip of the spear at trying to figure out what is really important. I teach my patients about cardiology one-on-one, and this is my best format right now to do one-to-many, in addition to doing the many podcasts I've done. Just got back from Las Vegas, where I attended the Longevity Fest conference. I know it's always ironic that the World's Healthspan Longevity Conference is in Las Vegas in December, but it is what it is. Great meeting for connections. The expo hall, get to see what's latest and greatest, and catch up with a lot of good friends. Got to see my friend Dr. Lyon give the keynote speech, where she got to teach 8,000 to 9,000 doctors, which was the largest conference they've had. And her topic was her muscle-centric medicine philosophy. So if you work with me, you understand that this is where I learned it from. Your muscles are your organs of longevity. And so you got to focus on your strength training, got to get your dietary protein in. So for those that are in my school community, I'm sharing what I learned at these conferences. I spend thousands of dollars a year on my education, and I distill it to my one-on-one patients, do it here as well when I can, but the more in-depth education is going on in my school community. So did learn a few interesting things at this most recent event. Learned a lot about psychedelics, learned about brain function for Dr. Perlmutter, learned about hyperbaric oxygen, learned about the Apollo Neuro device, which I've had for many years, but heard an excellent presentation by the gentleman who's a psychiatrist who actually developed the device. And I will start sharing a lot more of those my feeds and as well as the school community. So before I jump into the questions, there was a fun fact that I got to do yesterday. I've traveled many places around the world. I've never been called to offer medical services in a plane, but that streak broke yesterday. So got the is there any doctors on board call? Can you ring your bell? So got to do some medicine in the air. So not just telemedicine, I get to do international and space medicine now, I guess. Fortunately, the lady's doing well. Nothing bad happened. I just helped her not pass out was basically what ended up happening. So hopefully you never have to have that happen on a plane, but if so, and I'm there, I'll make sure I can do what I can to help you out. So jump into the questions tonight. Question number 1, what does a lipoprotein A blood test look for? It's a serum blood test. It's looking for the number of lipoprotein A particles that you have. Lipoprotein A is genetically determined to be at a certain level. About 20% population has elevated levels. Lipoprotein A is the number 1 genetically inherited lipoprotein that increases the risk of cardiovascular disease. Depends what labs you use, but generally the cutoffs are either above a score of 50 or a score above 75 nanomoles per deciliter. Generally, you want to look for the milligrams per deciliter version, but just look for the cut point where it is. The higher LPA, the more risk of aortic valve sclerosis and stenosis, more risk for coronary atherosclerosis. So right now, there's not great drugs at lowering LPLA. The PCSK9 inhibitors do have some effect at lowering them, but the drugs that will really knock them out of the park, the antisense oligonucleotides and the small interfering RNA molecules, they're at least 1 to 2 years away before being released to the market. In the interim, you can monitor ApoB because if you can lower the ApoB particles on LDL, you can lower risk. And I will frequently look for LPPLA2 activity, look for interleukin 6 or IL-6, and then look for OXPL ApoB, which is only available on the Boston Heart Diagnostics panel. If those 3 labs are elevated, then LPA is inflaming your arteries and potentially laying down plaque. Next question of tonight, pertaining to statins, is rosuvastatin better than others and with minimal side effects? It's one of the better ones and the one that I tend to think is my workhorse that I use the most often. Most patients can tolerate the lowest doses. Sometimes, patients can only tolerate twice a week dosing. Rosuvastatin does have a relatively long half-life, so usually get away with it, using it twice a week in some individuals. Don't get all the benefits, but maybe about 70% of the benefits. And if people are really sensitive, start with 5 milligrams and work your way up as needed. If you have access to the Boston Heart Diagnostic Panel, you can look at the cholesterol balance test. The top right of the first page, if the desmosterol levels are low, then you may need to back off from the statin. People tend to have more brain fog or side effects if you lower desmosterol too much with statins. Now, the statin that tends to have the least side effects really is pravastatin, in my experience. Just not as potent, that therefore it's not going to tend to cause many side effects. But that's generally the statin that they use in the hospital when patients have liver transplants or kidney transplants. Pitavastatin or Livalo, it's the newest statin, tends to have less muscle symptoms, but was only recently released as a generic. So for many years wasn't really used because of the cost differential. But if you can't tolerate many statins, many people can tolerate pitavastatin or Livalo. All right, and then I know somebody sent a message in my story, but didn't make it to the comments here. But they had a question about aldosterone. Do I test for it for patients with hypertension? Yes, generally, as long as the person's not already on spironolactone, an ACE inhibitor, or angiotensin receptor blocker. If they're on one of those three medicines, it'll affect the aldosterone level. But if they're not, high aldosterone is associated with high blood pressure because high aldosterone makes you hold on to salt. Salt makes you hold on to water. It dilates the blood vessels and increases the blood pressure. High aldosterone often is a reason for people to having resistant hypertension, meaning it takes more than 3 medications for you to be able to control their blood pressure to a level generally less than 130/80. So I will check it in patients. If it's high, the person may have an issue with their adrenals. Then you send them off for imaging and potentially a surgical evaluation if that's true. And then the next question up tonight, is there any treatment or special diet for the beginning of the onset of renal failure? So this is not my area of expertise, but there's definitely a connection between the heart and the kidneys. There's a cardiorenal syndrome. So if your kidneys are starting to fail, and you can assess that not only looking at creatinine levels, you can look at cystatin C, STMA, and then you can see if there's proteinuria by looking at a urine microalbumin creatinine ratio. The more proteinuria you have, the more kind of acute or more problematic the renal failure is. Big treatments are keeping the blood pressure well controlled. Really would shoot for that 120/80 goal, keeping the hemoglobin A1C as low as possible, and then making sure it's not due to some type of autoimmune condition. So we can look at ANA, HSCRP as kind of quick checks. But if you don't have a ready explanation from your primary doctor, then it's often worthwhile to work with a nephrologist to figure out why the kidneys are failing. The renal diet can be restrictive. You're generally going to be lower in phosphorus, certain calcium has to be monitored. Your other electrolytes, potassium has to be generally monitored. So lower potassium diets generally in those individuals. But you have 60,000 miles of blood vessels. So improving blood flow to the kidneys can slow that process down. Nitric oxide is critically important for that process. So if you can't get it through your dietary intake of dietary nitrites, green leafy vegetables and beets, you're not getting it from your exercise, you're not getting enough UVA sunlight, then there are nitric oxide promoting supplements that can help. If you can get more oxygen and blood into a tissue, oftentimes you can get the waste products out and the function may improve. So test, don't guess. Right. So I don't think there's a lot of pre-submitted questions tonight, so I'll wait for some of the comments if anybody does have a question. Waiting for them to come in. I was saying that, I just got back from Las Vegas Longevity Conference. There was no real great cardiovascular breakthroughs at this conference, and I was also really looking forward to seeing if there's any good AI updates. Learned a couple tools that I might be able to use in my practice, but nothing as groundbreaking as the one that I went to a couple months ago with the Mayo Clinic guys. Now I do have it up in my office. I have the Echo device, which can tell you if your heart function is less than 40%, your ejection fraction, the medical term. It can also tell you if you have a heart murmur, which I can hear, but this can record it, with my medical assistants recording it. And then it will also tell you if you have atrial fibrillation. So that's just a starting point. I put in the work purchase order for the AI EKG device. It's going to take a couple weeks for the companies to build it. But then hopefully early next year, I'll have access to a device that can tell you your age, from an EKG, basically kind of like a vascular age, but it's going to tell you your electrical age. And they will also tell you if you have a weak heart. But in the future, there's going to be FDA algorithms that can tell you what is your risk of having heart disease, what is your risk of having liver disease just off your EKG. So we have that going live in 2026 at Apollo Cardiology. And then I was also sharing that my school community is still growing. That's where I put my longer form content, all the things I learned at these conferences. That's where I'm sharing that information. Instagram just doesn't have a way to share PDFs and share, dictations of transcripts of these conferences. So I have to put it somewhere. So the school community is there. It's drtwyman.com/school, or if you go to school.com/drtwyman, you'll find the group. There's always a 7-day free trial you can check out, any of the prior content. I have courses in there on how to read your own labs, how not to die, basically what cardiovascular testing to look at to evaluate your risk of having a heart attack and stroke. I have an AI-generated summary of my top 30 podcasts. So if you don't have 30 hours to listen to some of my content, this does it in 20 minutes and gives you the best highlights. So check it out. I do a live there at least once a month. The archives are there. And if you're interested in staying, it's only $20 a month for the time being. That's going to be the lowest price it's ever going to be. As I roll out more and more AI tools to that group, the prices will eventually be going up. So there is a question dropping in. Do nitric oxide supplements interact with statins, blood thinners, blood pressure medicines? For statins, no. For blood thinners, no. For blood pressure medications, not necessarily interact, but they can help support low or healthy blood pressure. So if you do start one of these supplements, you do need to know what your blood pressure was beforehand. And if you're getting lightheaded or dizzy, one of these supplements may be driving it. So if you're somebody who has stents, definitely potentially has an effect at reducing inflammation, oxidative stress to the lining of the arteries so that you hopefully don't end up with more stents. Think of nitric oxide as promoting a force field so that the arteries don't have cholesterol particles and white blood cells stick to the arteries. Won't necessarily have as much effect on the AFib, but may have an effect by keeping inflammation lower with it. All right, so I'm not seeing any other questions coming in tonight, so I'll keep it short and sweet. The archive of this will be on the Instagram feed for at least a month, but I always take these, download them, run them through an AI transcript generator, put them up on my YouTube channel, which is just drtwyman.tv. So if you're ever looking for archives from 2-3 years ago, my YouTube channel will have those. So hope you guys have a good week. Hopefully you're staying warm. I was in Vegas, it was 70, came back to St. Louis, it was like -8, but got to work on my cold thermogenesis, get my brown fat working a little bit better so I can get ready for some colder weather next year. So hope you guys have a great rest of the week. I'll see you next Monday, 6 p.m. Central Time.